Hey everyone, let's talk about something that might be hitting close to home for some of you. Feeling constantly drained and noticing your skin looking paler than usual. It's a common concern and it's definitely something worth paying attention to. We're talking about that feeling where you just can't seem to shake off the tiredness, no matter how much sleep you get. And on top of that, you catch a glimpse of yourself in the mirror and notice your skin has lost its usual vibrancy. Now, don't jump to conclusions just yet. It doesn't necessarily mean something serious is going on. It could be something as simple as not getting enough sunshine or needing to tweak your diet. But it's always better to be safe than sorry, right? So let's dive a little deeper into what might be causing this and what you can do about it. Remember, this information is for educational purposes only. It's not meant to replace the advice of your doctor. If you're experiencing these symptoms, make sure you schedule a visit with your healthcare provider to get a proper diagnosis and personalized treatment plan. Now, let's talk about some signs and symptoms that often go hand in hand with feeling weak and looking pale. Keep in mind that everyone's different, so you might not experience all of these. But if you're noticing several of them, it's worth bringing it up with your doctor. First and foremost, there's fatigue, that overwhelming sense of tiredness that just doesn't quit. It's not your typical "I need a nap" kind of tired. It's more like your body is running on fumes, even after a good night's sleep. You might also feel dizzy or lightheaded, like the room is spinning. Other common symptoms include shortness of breath, even with minimal exertion, and a rapid heartbeat, especially when you haven't been particularly active. Some people also experience numbness or tingling in their hands and feet, which can be a sign of nerve involvement. And of course, there's the pale skin itself. This happens when your body isn't producing enough red blood cells, which are responsible for carrying oxygen throughout your body. Without enough oxygen, your skin can take on a pale or even yellowish hue. So what exactly causes this dynamic duo of weakness and pale skin? Well, there are actually quite a few possibilities, ranging from mild to more serious conditions. Let's start with one of the most common culprits, anemia. Anemia is a condition where your body doesn't have enough healthy red blood cells to carry adequate oxygen to your tissues. There are different types of anemia, but the most common one is iron deficiency anemia. This happens when you don't have enough iron in your body to produce enough hemoglobin. Hemoglobin is a protein in red blood cells that carries oxygen. Other types of anemia can be caused by deficiencies in vitamin B12 or folate, which are also essential for red blood cell production. Another potential culprit is dehydration. When you're dehydrated, your blood volume decreases, which can lead to fatigue and pale skin. Certain medications, like those used to treat high blood pressure or chemotherapy drugs, can also cause these symptoms as a side effect. And then there are more serious conditions like heart problems, lung diseases, and autoimmune disorders, which can also manifest as weakness and pale skin. That's why it's so important to see your doctor to get a proper diagnosis and rule out any underlying medical conditions. Section 4. Cracking the case. How doctors figure it out. Now, let's talk about how doctors diagnose the underlying cause of your weakness and pale skin. The first step is usually a physical exam and a chat about your medical history. Your doctor will ask you about your symptoms, how long you've been experiencing them, and any other medical conditions you have. They'll also check your vital signs, like your blood pressure, heart rate, and temperature. To get a clearer picture, your doctor might order some blood tests. A complete blood count, or CBC, is often the first test they'll order. This test measures different components of your blood, including your red blood cell count, hemoglobin levels, and hematocrit, which is the percentage of red blood cells in your blood. If your CBC results suggest anemia, your doctor might order additional blood tests to determine the type of anemia and its underlying cause. For example, they might check your iron levels, vitamin B12 levels, or folate levels. Depending on your symptoms and medical history, your doctor might also recommend other tests, like an electrocardiogram or EKG, to check your heart rhythm, or a chest X-ray to rule out any lung problems. Section 5. Bouncing back treatments to regain your strength and color. The good news is that once your doctor identifies the underlying cause of your weakness and pale skin, there are effective treatments available to help you get back on track. If your symptoms are due to anemia, treatment will focus on correcting the deficiency. For iron deficiency anemia, your doctor might recommend iron supplements or, in more severe cases, intravenous iron therapy. For vitamin B12 or folate deficiencies, you'll likely need to take supplements to replenish your levels. If dehydration is the culprit, the solution is simple: drink more fluids. Water is always the best choice, but you can also sip on electrolyte drinks or broths to replenish lost fluids and minerals. If your symptoms are caused by an underlying medical condition, treating that condition will be crucial in improving your energy levels and skin tone. Your doctor will work with you to develop a personalized treatment plan based on your specific needs. Section 6. Fueling your recovery: the power of a nutrient-rich diet. While medical treatment is essential, making certain dietary changes can also play a significant role in managing your symptoms and boosting your overall health. If you're anemic, incorporating iron-rich foods into your diet is key. Excellent sources of iron include red meat, poultry, fish, beans, lentils, tofu, spinach, and fortified cereals. To enhance iron absorption, pair these foods with vitamin C-rich foods like citrus fruits, tomatoes, and bell peppers. For vitamin B12, focus on foods like meat, poultry, fish, eggs, and dairy products. If you're vegetarian or vegan, fortified plant-based milk, nutritional yeast, and breakfast cereals can provide vitamin B12. And don't forget about folate. Leafy green vegetables, citrus fruits, beans, lentils, and fortified grains are all good sources of this essential nutrient. Section 7. You've got this. A final word of encouragement. Feeling constantly drained and noticing your skin looking paler than usual can be concerning, but remember, you're not alone. Many people experience these symptoms, and with proper diagnosis and treatment, you can regain your energy and vibrancy. Don't hesitate to reach out to your doctor if you're experiencing these symptoms. They're your best resource for getting to the root of the problem and developing a personalized treatment plan. In the meantime, prioritize self-care, get enough sleep, manage stress, stay hydrated, and nourish your body with nutrient-rich foods. You've got this.